Robert Morris University School of Nursing and Health Sciences is pleased to present an interprofessional standardized patient simulation depicting a patient presenting to the primary care setting with the complaint of back pain and demonstrating drug-seeking behaviors. The Access to Interprofessional Mental Health Education project is funded by a federal grant from the U.S. Department of Health and Human Services. The following video has been developed to model the integration of behavioral health in the primary care setting with the overall goal of highlighting interprofessional collaboration. Objectives to consider while viewing the video include the history and physical examination, the mental status of the patient, differential diagnoses to consider, signs and symptoms of drug-seeking behavior, motivational interviewing techniques, patient education, and referral sources for treatment. Critical thinking and reflection questions include, if this was your patient, what would you have done differently? What physical examination techniques were implemented? Was any part of the exam omitted? What are the differential diagnoses in a patient presenting with low back pain? What techniques can a provider implement to maintain objectivity when working with a drug-seeking client? What are some indications of drug-seeking behavior? What are some risk factors for opioid misuse? What are some risk reduction strategies that providers can implement when prescribing opioids? What are some treatment options for patients who have an opioid use disorder who are presenting with chronic pain?
Hello, Mr. Smith. I'm Denise. I'm one of the practitioners here.
Hi.
Tell me what brings you in today.
Well, I'm here because I've run out of pain medicine and I need to get some more. My back is in severe pain.
What did you do to your back?
A couple of days ago, I was helping a buddy move some furniture in his house, and I tugged on a large sofa, and I guess I threw something out in my back. It kind of twisted, and I felt a severe amount of pain. My legs kind of went numb, and went to the ER, got some medicine, but now I'm out, and the pain is back, and it really hurts.
Okay, so you hurt your back 2 days ago, and then when did you go to the emergency department?
Right afterwards.
Okay.
Mm-hmm.
And they gave you some pain medication?
Yeah.
What did they give you?
Gosh, I think the name is Norco or Narco?
Norco?
Norco. Mm-hmm. It's 325/5, whatever that means. I just remembered that because I hopefully can get the same medicine because it works.
Okay.
I just happen to have run out of it.
Okay, well, let's talk a little bit more about your back pain. Where exactly is the pain? Low back, mid back?
Yeah, it's my lower back. It crossed the entire width of my back, kind of right above my hip bones.
Both sides?
Yes, ma'am.
And does the pain go down your leg at all? Or?
You know, I'll get shooting pains down the outside of my leg, and I also get kind of intermittent numbness and tingling, too.
Okay. And when you say it goes down your leg, both legs or just one leg?
No, both sides.
Okay. And are you having any other symptoms as far as loss of control of your bowels, loss of control of your bladder?
I'm not having those symptoms, no.
Okay. Any numbness around your private areas at all?
No.
Okay. Have you ever hurt your back in the past?
Yeah, I have. This all started when I was involved in a car wreck about a year ago.
Okay.
Yeah, I got hit from behind. It was kind of one of those low-speed impacts. They took me to the ER. They did x-rays and scans of my back. They couldn't find anything. The doctor just said it was severe twisting and straining. Mm-hmm. So it took a few weeks for the pain to finally subside, and then I've been all right until, of course, I strained it again moving this furniture.
Mm-hmm. Mm-hmm. And do you have any other medical problems? High blood pressure, diabetes, anything else?
No, I'm fairly healthy. I don't have those problems.
All right. And what kind of work do you do?
Well, I'm out of work right now. I'm trying to get some kind of workman's compensation or something because I'm unable to sit at my desk. I'm an accountant. Shortly after this car wreck, I had to, stop coming into work because I just couldn't stand it. The pain was intense. So I eventually got let go. So trying to find out a way to maybe get some kind of workman's comp. Because I cannot sit at a desk.
Okay. What about, do you smoke at all or use any tobacco products?
Yeah, I do. I do smoke occasionally. I wouldn't consider myself a serious smoker. I'm guessing about maybe a pack a week.
Pack a week. And what about alcohol?
I'll have a few beers on the weekends, but that's it.
And any illicit drugs?
No, ma'am.
Okay. All right. Well, let me examine you and see what we can find there.
Okay.
First of all, I just want to listen to your heart and lungs.
Sure.
So I just want you to breathe normally initially. Okay, now I want you to take a couple deep breaths.
Okay.
Okay, that's good. Your lungs sound nice and clear. Now let me just touch the back and let me know if anything feels tender.
Wow, now it starts to hurt as you get near the area.
Okay. Does it seem to be worse on the sides or in the middle?
It's kind of equally painful across the entire width.
Okay. All right, why don't you come on down on the floor? I just want to see how you're able to walk.
Okay.
I want you to just take a few steps for me, if
All right.
you would. Okay, that's good. And now come on back towards me slightly, and I want you to just stand on your toes for just a second. Heels for just a second. That's good. And now I'd like to just see your range of motion. If you could try and bend down and just try and touch your toes.
Oh, that hurts.
All right. Just take your time. All right, that's pretty good, actually. All right, come on back up. Just take your time. And now I want you to just, I want to see your side motion.
Okay.
Okay, that's good. Now come on back up on the table for just a moment. I just want to check your reflexes and your strength as best you can. And take your time there. All right, and just relax your legs.
Okay.
Okay, good. And push against my hands with your legs. Pull back with your legs against my hands. Pull up with your toes. Can you feel me touch you on both sides, and does it feel the same?
It feels the same, though there's some slight numbness on my legs, yes.
Slight numbness. Now that numbness that you have, is it always there, or does it sometimes come and go?
I would say it sometimes comes and goes. It's not always there.
Okay. One more thing with your exam. I'd like you to lay back. I just want to examine your abdomen.
Okay.
Let me just...
Oh, man.
No belly pain at all.
No.
Okay, come on and sit up, and I just want to talk for a little bit. Well, I understand that you're having a lot of pain right now, and we want to help you with that pain. A couple things, just to let you know that I don't see any danger signs. Whenever I have a patient with back pain, I worry if there's any danger signs. Danger signs would be if you lost control of your bowel or bladder, if you had any numbness around the privates, or if you had numbness and tingling that never went away. Those would signify to me that there would be some nerve impingement, pressure on the nerve. But I would like to have our mental health provider come in and talk with you for a few minutes just before we come up with the plan of care, because I think we need to attack this from a number of different angles.
Okay, whatever you think's best.
All right, I'll be right back, okay?
Okay.
Thank you.
Hi, Jacob Smith?
Yeah, that's me.
I'm Sherry Schaefer, a psychiatric nurse practitioner. Thank you for agreeing to see me today.
Okay.
So
No
I'm just
problem.
going to sit down and we're going to talk for a few minutes, okay?
Okay.
Dr. Ramponi informed me that you've been at this for a while with some pain.
Yeah, I mean, a car wreck a while back and then moving furniture that aggravated that old injury, yes.
Tell me before that you moved to furniture, how well was the pain controlled for you?
You know, it was pretty good. I wasn't on any type of medicine for it. It took a long time to resolve after the initial injury, but after it went away, it pretty much went away.
Okay, and now it's back.
Yes.
Yeah. Okay. Over the time period of the year, have you noticed this pain coming and going for you different times like this?
I haven't really noticed it like that, no.
Okay. Now, tell me a little bit about your life before a year ago with the injury.
Well, it was a lot different than now. I was working as an accountant. I was more active. I had more of a desire to be physically active, to walk and exercise more, to travel. Ever since the car wreck, I've lost kind of a lot of that desire to get out there and do things because I guess I'm a little afraid
Sure.
that my back just can't handle it. I'm afraid I'm going to re-injure it, and of course that's exactly what happened.
Yes. Tell me how you were able to sleep at night. How does that go for you?
Not good. I have a hard time falling asleep. Once I am asleep, I find myself waking up in the bed and moving around. I guess I think too much about what's going on, about the day ahead or what just happened. So I have a hard time falling back to sleep. So I guess my sleep's pretty crummy, really.
And your energy level?
Low.
Okay.
Yeah. I don't have much desire to do things.
Now, as an accountant, I'm assuming you must have had an excellent attention span at one point and concentration.
I really did. I was able to focus a lot better. But after the car wreck, my back started to bother me more and more when I was at work. That led to issues with my boss, and then I eventually was let go because I was taking too many days off. But that was during the period when I was recovering from the car wreck.
Sure.
There wasn't really enough time for me to recover before I was let go. So now I'm trying to figure out what my options are to try to get my job back, or I'm really at a loss to what to do.
Do you find you can still enjoy things you used to enjoy doing?
I mean, not as much. My wife works long hours as a nurse. I don't see her very often. Being out of work, it can kind of play on your mind a lot. I just watch television and stay at home most of the time.
Sometimes I hear people tell me that they just feel guilty for no reasons at all. They just have a lot of guilt feelings. Does that describe you at all?
I guess I'm guilty feeling in regard to the amount of money that I'm not bringing into the home. We're living off my wife's salary now, and that's not very large. Not having a job has really impacted our family. So I guess I feel guilty that I'm not bringing any money in.
And now, a question I ask everyone. Have you ever thought life wasn't worth living?
No,
Okay.
I don't think I've ever reached that point.
Good. Okay. Glad to hear that. Now, tell me your understanding of back pain management.
Well, right now it's not being managed very well. I think I need more medicine because when I can take pain medicine and the pain is, mitigated or goes away, then I do feel a little bit about what you just discussed with me. A little of my old self is back. I feel more hopeful, more energetic, more positive.
I'm sorry, go ahead.
I was just going to say that when the pain is there, the exact opposite's true. I feel like doing nothing. I don't feel motivated. I don't feel hopeful. So pain medicine has been the one thing that's given me some encouragement.
Has your wife ever said that she's concerned about being a nurse? I'm sure she has some things she likes to say about how you're doing and your treatment. Does she ever say anything about concerns about pain medicine or management?
She was curious why I was out of medicine.
Okay.
And I didn't have any explanation for her other than when it hurts really bad, I take a couple extra pills, and when days lead into a couple more days, then all of a sudden I'm out of medicine a little early.
Has anyone ever said to you that do you feel you've become depressed from everything that's happened to you?
I'm not sure they use those words, but I have had people tell me that I feel like that they think that I'm not myself, or they can tell that things have changed with me, that I'm different. Whether that's depressed or not, I don't know, but I guess I'm a little bit down all the time.
So that's something that sounds like maybe we could explore together.
If you think it would do any good.
Okay. Jacob, what I'd like to do is talk with Dr. Ramponi for a few minutes so that we can provide you with a very comprehensive treatment plan. You have been in pain for a long time, and we want to give you the best chance of this being managed well, and try to get you back to feeling like you used to feel, with some interest and energy. And we've learned a lot about pain management, believe it or not, we have. So we do have lots of different options. Does this all sound like something you would be interested in?
I don't have insurance right now. I mean, if I can afford it, sure, but that's, I guess, another worry, that I'm afraid of not being able to pay for my own medical care.
Well, we'll certainly explore those avenues with you also. There are various programs that might be out there that could help you with that.
Okay.
So we certainly don't want to give you another stressor on top of what you already have. Okay?
All right, then I'm open to exploring whatever you recommend.
Thank you so much. I will be back in. Thank you for talking with me.
Okay.
Jacob, we're back.
Okay, hi.
Hi, Mr. Smith. Sherry and I have been talking about your back pain and how it's been somewhat troublesome to you, and I think we have a good plan of care. One of the things that we did review when we left the room was we looked at the ER record from a couple days ago, and it looks like they gave you about 30 Norco, and that really should have lasted you probably about 7 days, and it's only been 3 days since the injury and since you were seen in the ER. So we really need to attack this back pain from a number of different angles.
What do you mean it should have lasted me longer?
Well, the pain medicine should have been 1 tablet every 4 to 6 hours. And you had mentioned to me that you were already out of the pain medication.
Yeah, when I started to have severe pain, I took a couple extra pills to get rid of the pain. So I ran out early.
This is actually very common, okay? And it's one of the reasons why we would like to offer a different plan of care to you, okay? We hear your pain, and we certainly want to help you with the pain. But in your brain, there are many ways to attack pain. Pain medication, such as the Norco that you've been taking, only interrupts the pathway from the body and the brain. So therefore, it is always just going to be sort of like putting a Band-Aid on a huge wound. Also in the brain, when these medications are introduced to the brain over and over again, you can actually have a need for more of them in order for them to work. So therefore, no matter how many we give you, eventually you will need more for managing even the same pain that they used to manage. So while you might get some temporary relief, which I'm sure is very important to you, they're not going to help you get your life back.
Wow, okay.
I also heard you tell me about how your life has changed since the accident 1 year ago. How your sleep is, how your energy level is, your interests, everything. And I do believe that what also has happened in your brain is that your serotonin level, one of the chemicals in your brain, is now much lower.
Oh.
And that leads to these feelings that you are describing and also enhances the pain.
Really?
Therefore, if we treat this from a couple different angles, as well as some of the physical therapies that Dr. Ramponi is going to offer, I think that we can give you a much more comprehensive package. The first thing I would like to talk about is a medication that's been out for years, very cheap medication called Sinequan or Doxepin. It's very helpful with pain, It's not going to cause the upregulation, and you need more of it. It can help slightly with the mood, but also definitely help with sleep. So with this medication, I'm going to be helping your sleep pattern and your pain at night. I'd like you to take one every night, okay? Then we also have some samples of some antidepressant medications.
Antidepressant? Am I depressed?
Yes. You are meeting that criteria, but again, that's the serotonin in the brain, and it gets used up. You know, when we have a lot of stress, sometimes genetics plays a role. We can actually not have enough serotonin. This is a real neurochemical change, but we can treat it as we treat other disorders.
Okay.
I happen to have some different samples, and I'd like to give you some of the medications. Now, they take a little bit of time to work, so therefore we're going to start low and go slow, and I'd like to ask you to come back and see me every couple of weeks, and we're going to have a case manager work with you on the financial end of things, so that we can make sure we're giving you care and not giving you another problem. Wow. Does that sound reasonable at this time?
It sounds reasonable. It also sounds a little scary.
Sure. It is definitely a change, and I know that I'm hearing you tell me that you want your life back.
Yes.
And I'm also hearing you tell me that the only relief you've received over the past year has been from taking the narcotic medications.
That's true.
So I understand that I'm probably causing you some anxiety, but I hope that maybe you can work with us and give us a chance to maybe help your life get better and the temporary relief be much longer.
Okay, sounds okay so far.
The other thing we want to do is try and approach it from the physical perspective with regards to your back pain. I'd like you to try some physical therapy, which oftentimes is very beneficial. They do massage, they do ultrasound, they do TENS, where they have stimulation of the muscles. The other thing that we can offer you is a pain management specialist who specializes in pain. They oftentimes will provide nerve blocks so that this can be a more permanent relief for you. So I think if we attack it from a number of different angles, that would be the best approach for you.
Wow, it's a lot to digest, but okay, I guess I should give it a try.
Thank you. Now, Jacob, the last thing I want to bring up is that the narcotics that we were talking about, how your brain demands more for the same relief, okay? It's not a matter of you personally saying, I want more. It's your brain and body saying, this isn't doing the job anymore.
Right.
When we pull back on those, we sometimes some people will tell us that they actually can feel more pain for a while. And so, therefore, we have talked about the fact that we are still going to give you some of those temporarily, okay?
Oh, thank goodness.
But we need you to take them as we're prescribing while working on these others, or we won't get where we need to be. Can we count on you to do that for us?
Okay.
Okay.
I'll do it.
All right. And so, therefore, if we calculate what you've been using for the past 3 days, we're going to at least take that down by 25%, and every few days go from there. But remember, we're giving you other treatments, okay? If that gets to be too difficult, there's also some other supplemental counseling we can do.
All right, I know my wife will be happy, so because of that and because of what you've told me, I'll give it a try.
Thank you. It's been very nice to work with you.
Okay.
All right, and we'll have the case manager come in and talk with you also so that we can make sure that financially this is taken care of as best we can.
Oh, I appreciate that too. Thank you very much.
All right, thanks.
Thank you.